joining us for this really important event. And I'm especially grateful to have Surgeon General Dr. Vivek Murthy here with us, along with Dr. Chris Ladish and Elizabeth. She is a student at Rainier Beach High School to talk about the mental health challenges that our youth are facing. I know these are really tough issues to talk about, so I really appreciate all of your willingness to speak out and share your stories. So thank you. You know, this pandemic has been really hard on absolutely everybody, but it's been especially disruptive for children and youth. I've heard from so many parents who are concerned about this, and with good reason. And I've heard from many kids who just had their lives turned upside down. We actually have new data from the CDC that shows that more than a third of high school students experienced poor mental health during this pandemic, and nearly half felt persistently sad and hopeless. We also know that youth health emergencies have skyrocketed, with sharp increases in kids' visit to the emergency room for mental health crises, thoughts of suicide attempts, especially among girls. And as of February, over 200,000 children have had their world shattered after losing a parent or a caregiver to COVID-19. So as a mom and a grandmother, it really breaks my heart to know so many kids are shouldering so much stress and anxiety and trauma and more. That's exactly why, as a senator, I am working hard every day to get our kids the support and the care they need to heal. I fought in the American Rescue Plan to provide funds to help our schools not just reopen safely, but also address students' social, emotional, and mental health needs as well. Schools and districts can use these resources to reopen with more counselors and mental health professionals and support for our students who are struggling. I fought to make sure that the recent bill we passed, the year-end funding bill, included boosts to get more resources to our kids and to the adults who need support. And right now, I am working on a bipartisan mental health package where I'm pushing to strengthen federal programs that support youth mental health services, improve suicide screening and prevention to save lives, and make it easier for people to get mental health care and more. And as I continue working on this bill, it's really important for me to really reflect the scope of this crisis, support communities who are facing the greatest hardships, and address the challenges that families are facing in Washington State, which is why discussions like we are having today lift up the voices of people who are experiencing these challenges firsthand and help us do the right thing at every level. I'm also incredibly glad to have Surgeon General Dr. Murthy with us today. He has been a leading voice on these issues for years now, and thank you, Vivek, for doing that. I want him to hear directly from people in Washington State about the mental health care crisis our kids are facing. I'm also really grateful to Dr. Ladish for joining us with her expertise, and Elizabeth, thank you for your willingness to be with us today and share your story. So let me turn it over to Surgeon General Dr. Murthy.
Well, thank you so much, Senator Murray. I appreciate your kind words. And I'm just grateful for the opportunity to be here with you, with Dr. Ladish, and especially with Elizabeth, our youth advocate, who's here today. And we're all here, you know, obviously to talk about this important subject of youth mental health. I think it's particularly important to note the work of the Senate Help Committee under the leadership of Senator Murray and Senator Burr, who've been working in a bipartisan way to reauthorize and improve and expand our federal mental health and substance use disorder programs. You know, I come at this issue not only as a Surgeon General and as a doctor, but as a father as well. I have two children. They're 4 and 5 now. And as I think about the world they are growing up in, as I think about their future, I know that despite being the overprotective parent that I am, that I can't always be there for them, that I will rely on counselors in schools to be able to look out for our kids if they're having trouble. I'll have to rely on other kids around them being kind and compassionate and supporting them, especially if they may make a mistake or stumble. I'll rely on a healthcare system that can be there if my children do need professional help. But for too many kids right now, these services are not available to them. Too many don't have access to treatment. And we know that it takes on average 11 years from the time a child experiences mental health symptoms to when they can actually get evidence-based care and treatment. That's 11 years on average. Is a stunning number for the richest and most well-resourced country in the world, a country that I believe values our kids deeply, but we need to do better to do right by them. And that's just a reality for too many kids. But we also know that too many children do not have exposure and access to prevention programs in schools or in their communities, which we know can actually help reduce the rates of anxiety, depression, loneliness, and such, yet we see too few of these programs. And finally, we know that many of our kids are struggling with a terrible stigma around mental illness, and that prevents them from talking about their struggles. It often prevents them from asking for help when they need it. So all of this is what we have to change. You heard some of the statistics from Senator Murray about the recent CDC study that was released that spoke to the impact of the pandemic on young people. And those numbers are staggering, especially when you look at the nearly 200,000 young people who've lost a caregiver and at the rise in anxiety and depression, particularly early on in the pandemic. But we also know that this was a problem that preceded the pandemic, that our kids were struggling before COVID arrived. In fact, in the decade before the pandemic, there was more than a 40% increase in the proportion of high school students who said that they had been feeling persistent feelings of sadness or hopelessness, and that has worsened during the pandemic. We also know that around the 10-year timeframe before the pandemic began, that there was a 57% increase in the suicide rate among youth aged 10 to 24. And these have all been driven by a number of factors, some of them having to do with the prevalence of loneliness and isolation, some of them having to do with online and offline bullying. We've also seen that technology has been a mixed experience for our kids, where in some cases it's helped them, particularly social media, to be more connected to old friends, but in other cases it has actually worsened their self-esteem and has made them feel more lonely, more anxious, and more depressed. And we also know that young people today are growing up in an environment where they are looking at the future, at the threat of climate change, at the threat of, an ongoing threat, I should say, of racism. They're looking at various forms of inequality, including economic inequality, and they're asking the question, is there a place for me in the future? Is the future really bright? You put all of these factors together, and it's not a surprise that our kids are struggling. I'll finally say in closing that this is more than just an issue that we can pay attention to for today and then move on tomorrow. This is an issue that fundamentally affects the underpinnings of our society, our kids. It affects what I believe is the most important sector of our society, and that is our children. And it's for this reason that in December of last year, I issued a Surgeon General's advisory on youth mental health to call our country to attention to address this urgent crisis. And that advisory includes recommendations not only for government and the healthcare sector, but also for individuals, for communities, for educational institutions, and for other community organizations, because this is going to be a broader team effort. I just came back, by the way, from a trip to San Diego, where I heard once again just how important this issue is to young people across America. At the YMCA in San Diego, I heard about different programs that the Y is putting together to help provide kids with a sense of community. I also spoke, to children and to families at a naval base at Point Loma in Southern California, where it just been so clear how many military families are worried about their children, especially as they've sustained many moves and the pandemic and then deployments on top of that. It's been tough for many of these children. And just this morning, I heard from fifth graders at Thompson Elementary School right here in DC about just their struggles. I heard from teachers who were telling me that they have seen an incredible rise in the number of kids struggling with anxiety and depression, including first graders. These are things that they were not seeing prior to the pandemic. So we have a lot of work to do, but I have never been more hopeful that we can accomplish it because of the greater awareness in the public about this issue, because of how many parents are getting involved in these conversations, because of legislators like Senator Murray who are recognizing that we cannot let this moment pass without taking decisive, clear action to help our kids. So appreciate all of you being here today for this conversation. And let me turn it back to Senator Murray.
Thank you so much. And I will turn it over to Elizabeth. And Elizabeth, again, thank you for sharing your story with us today.
Hello, my name is Elizabeth Ashley Dawson. I attend Rainier Beach High School. Today, I was given this incredible opportunity to come here and speak on mental health. I would have never guessed that I would ever have needed a counselor until I got offered one. That's how I ended up at ACRS. Starting in mid-July 2017, I finally started to acknowledge the hidden trauma that I had dismissed. I have learned how to truly feel emotions rather than coping by hiding them or passing them off as jokes. I've learned that some kids didn't grow up the way I did. I've also learned that kids did grow up the way I did. I've learned that every bad thing's come with the good. Honestly, that's what stuck with me. Since my grandma passed, who was my legal guardian, I've been allowed the opportunity to go on this crazy journey to emancipation. I wouldn't have gotten here without my counselor, Elaine Wu. She has been there for me and after my grandma's passing, or before and after my grandma's passing. I am grateful for her being a part of my support system. Through this tough time, I've been able to recover and finally get to the first steps of helping my community of unaccompanied minors. I've learned how to be independent and help other kids that are in the same situation as I am so that they will have the ability to receive the help they need and deserve. Mental health is no joke. It can mess up the way you look at things. For example, I started skipping school after my grandma passed. I knew it was wrong and I should not be doing it, but there was...
Pardon the interruption.
I'm so sorry.
The special ed meeting is in Ms. Kamal's office, room. Once again, special ed meeting.
I am so sorry.
No worries. Keep going.
For example, I started skipping school after my grandma passed. I knew it was wrong and I should not be doing it, but there was no one to stop me. The only adult in the house then was my uncle. He didn't care, to put it plain and simple. He never checked up on my little brother and I. The most effort he exerted was to feed us microwavable burgers. From this whole ordeal, I've learned, especially at the moment when I had finally gone back to school, is that I was really behind. Not only that was making me anxious, but the fact that A, I haven't learned anything, B, the stacks of homework, and C, seeing all the failed classes. Now that I have moved into a more stable environment, I am doing better. I've started making sandwiches, packing daily lunches, getting rides without feeling as guilty, and still being able to see my brothers. Nobody would have ever predicted their life would turn out this way, especially me, but I wouldn't say I'm disappointed. Hopefully my story inspires and motivates people who need it. It would be great if you were to support mental health services to help youth like me. Thank you for having me here today.
Thank you, Elizabeth. Really appreciate your sharing that. And we will hear from Dr. Ladish.
Thank you, Elizabeth. That was fantastic. And I'm so proud of you. I know that these things are very difficult to talk about. You give us all inspiration. So thank you. Good afternoon, Senator Murray and Dr. Murthy. Thank you so much for allowing me to join you today. Senator Murray, since we last met, children, of course, have returned to on-site school, but we continue to see the devastating impacts that the pandemic has had on our youth in the form of prolonged virtual learning, severe isolation, social unrest, multiple losses that kids are experiencing. I was recently looking into some of the research and noted that we now know that 1.3 million fewer children were enrolled in school nationally during the 2020 and 2021 academic year as compared to pre-pandemic during 2018 and 2019. 42,000 of those children, or nearly 42,000, reside in the state of Washington. And of course, as we're all identifying, children of color are disproportionately and unfairly represented in these statistics and truly deserve our attention. I believe that we have lost opportunities that kids have experienced in academic and social learning, and that the impacts of this are going to be seen truly for years to come. I believe we're just now starting to look at the tip of the iceberg, and I believe that these impacts will be broad, including learning, socialization, and as we certainly are seeing, mental health. We have previously talked about around 1 in 5 children suffering from a mental health condition. We're now quoting closer to 1 in 4. We know as many as 30% or 1/3, as you had indicated, of children are suffering from some form of depression or anxiety. Many children now, an entire cohort, are suffering grief and loss issues related to loss of a primary or secondary caregiver. And strikingly, more and more and younger children in their pain are turning to substance use to numb the effects of this when they have nowhere else to turn. A recent study suggested that as many as 45% of children who are indicating they're using substances are doing so in isolation, which is incredibly concerning due to the risk that's inherent in that. We're feeling this certainly in Washington throughout our sectors. If you engage with children, if you know children, then you're feeling this. Certainly in pediatrician offices, 50 to 60% of their caseloads now are for primary behavioral health visits. School districts are craving and asking for increased mental health embedded in the schools. And certainly we're experiencing in healthcare and in social service agencies. Sadly, as much as we all know that the emergency room is not where these children should be managed, many are still being managed in the emergency room because of our workforce shortages and our lack of available bed space. At Mary Bridge, where I work, as many as 50% of our bed capacity in the emergency room can be filled with a child that's struggling with a mental health crisis at any one point in time. And what I really want to mention that I'm not sure is being mentioned enough yet at this point is that many of the children that are staying the longest in our emergency rooms are children that are on the autism spectrum and children that have intellectual disabilities for whom there really is no quick and easy option for where they would be placed. We have a patient who's recently been in our hospital for over a half a year because there has been no safe place for that individual to board. And so I really want to underscore that while we're doing a lot of work, we have more work to do. In terms of the work that we are doing, I would encourage that we continue to bring embedded behavioral health into our primary care, into our school districts, into our social service agencies. We really need to come to the children rather than expect the families to come to us. I'd like to advocate for continued parity in telehealth reimbursement so that families that struggle to get to visits can have access to those visits more easily, that we continue to engage in prevention efforts such as mental health first aid and a mental health curriculum in the schools, and that we offer incentives to mental health practitioners throughout the United States to both continue to go into the field and to train within the states to continue to bring resource to the children that need it most. Finally, I just want to continue to underscore the importance of really focusing on our underinsured, our youth of color, LGBTQ youth, and those suffering from homelessness, because truly we can't turn a blind eye. So thank you, and thank you. I'm all in on this. So any way that I can be a help, please don't hesitate to call on me.
All right, that concludes the speaking portion of today's event. We'll take questions from press now. And I know we had one question from Julie. Julie, do you have a question? And then if not, folks can just use the raise your hand function.
Hi, yep. It's Julie with NBC News. I have a question for you, Senator Murray, and the Surgeon General as well. I know you released a comprehensive report earlier this year on youth mental health specifically, and now relevant Senate committees are working to address it with legislation. I was wondering if climate anxiety was at all part of your findings to the Surgeon General and to you. Chairwoman Murray, would this be addressed in the bipartisan legislation that you're currently working on? Because it's obviously a pertinent issue among young people in the United States, in addition to the other mental health crises.
Julie, thank you. I'll let Dr. Murthy answer as well, but mental health and substance use disorders don't exist in a vacuum. There are a lot of people with a lot of stress for a lot of different reasons right now. Certainly gun violence and climate change and systemic racism, trying to make ends meet, dealing with the outcome of the pandemic. I'll add to this stress that families are facing and young people are facing today. So that's why we need to reduce the stress, and certainly dealing with these large issues will help to reduce the stress for families. It has to be part of what we look at.
Just to build on what Senator Murray said at first, thank you for that important question. And Senator is absolutely right. There are many, when you think about mental health, as Dr. Ladish and Elizabeth know, there are many factors that drive and impact an individual's mental health, from their own family situation to the support they have in their community, the experience they have at school, but also their view of the world and the forces in the world and in their community. And the violence, unfortunately, is a reality for many young people, that they're a reality they're living with, and that contributes to a chronic sense of stress. Climate change is another, and we hear this time and time again in the roundtables that I do with young people around the country. So yes, we have to address those deeper underlying factors, but we also have to move in parallel to provide greater access to care. We have to look at the programs and the supports that we're providing in schools, whether it's counselors or investing in social emotional learning. And, and again, we've got to do all of this in parallel, because prevention, treatment, both are important. Addressing underlying causes has got to be part of what we do in the long term to improve mental health.
Thank you, Surgeon General. I'll just jump in to say, Senator Murray, we do need to get you to your next event if you want to hop off. But for any of the reporters, if you have a question for any of our speakers before, as Senator Murray leaves, rather, please feel free. We'll keep the Zoom meeting open for just another minute or two.
Great. Amir, before I jump off, I want to thank everybody who's participated in this. And Dr. Ladish, Dr. Murthy, thank you for your input. Elizabeth, thank you for your story. It's one many people share. And I think it's really important that today's conversation is a reminder that you never really know if someone around you is struggling with mental health. And it's important that we speak about it and raise the stories. And let's remember to be kind to one another and to treat our friends and our neighbors and our classmates and everyone with dignity and respect. But thank you again to all of you. Look forward to continuing to work with you as we develop this legislation.
Thank you.
Thank you so much. Take care.
Okay. Do we have any other questions from reporters before concluding today's press call? All right, terrific. Well, that concludes today's press call. Surgeon General Murthy, I'll turn it over to you if you have any closing remarks.
Well, thank you, Amir. I just want to extend my thanks to Dr. Ladish and to Elizabeth for being here, for lending your voice to this important cause, and to all the reporters who are joining us today. I just want to underscore one last thing that I know we've all said, which is that this is not just one more issue that we have to deal with. This is the fundamental issue that will impact the long-term trajectory, not only of our kids, but I believe of our country. If we cannot ensure that our kids have the support they need, then the future is not as bright as it should be and could be. And so this is what will require all of us to take action. Yes, government has an important role to play here, but as we clearly laid out in the advisory, this really has to be an all of society response. And it's why I've been actually very encouraged to see organizations stepping up around the country, from educators to healthcare providers to foundations to businesses, asking, how can we help? What can we do to help address the challenges that young people are facing today? So I just appreciate you covering this. My hope is that this is something that stays in the news, stays in public consciousness for a while, because it's going to take us some time to address all of these challenges that are driving the concerning numbers you heard about today. Appreciate it. Thanks, everyone. And back to you, Amir.